As more rollbacks are announced under CDC guidance, those who are not fully vaccinated should still be wearing those face coverings.
Yeah, that requires people to use the honor system with the mask, which for parents brings some concerns as kids under 12 aren't yet able to get the shot, of course. Tonight we're getting some advice from health experts about it.
There's no way to really verify or regulate in a public space, let's say like a grocery store, if the people who are not wearing masks are actually those who have been vaccinated or not. So if you are bringing your unvaccinated children into some of those spaces, assuming that there are going to be at least some people who are unvaccinated but unmasked.
And that's a concern to parents as Michigan begins to open back up with mask requirements loosening and capacity limits increasing. That's why Dr. Rosemary Olivero with Spectrum Health says the best practice is to still keep your face covered.
And what I'm recommending is that really when you're dealing with kids less than 12 who aren't vaccinated, really 100% mask wearing indoors outside of your own home. And so that, that is a challenging one as things are changing so much. And as people are starting to let down their guard. And it's also challenging for the situation where the parents may be vaccinated, but the children are not.
Aside from schools, which are being encouraged by the CDC to keep masking in place through the end of the academic year, another area of concern where kids may gather, especially as classes let out and we head into summer, is sleepovers.
And if you think about what a sleepover is, it is exactly that. It is an extremely long duration of time, usually somewhere between 8 and 10 hours, where children would be sleeping in very close proximity to each other without masks. And if we're talking about unvaccinated children, that really would not be an appropriate thing in the current COVID era.
So best advice, according to Dr. Olivero, try to avoid them. She also suggests sticking to current guidances. Again, wearing masks indoors when you're not at home, avoiding large gatherings with kids, especially if they're indoors, and only associate with people you know so you can be sure of their COVID prevention tactics. If we go in depth, since the start of the pandemic, the U.S. has seen more than 33 million cases of COVID. And according to the American Academy of Pediatrics, as of May 13th, 14% of the country's COVID cases were in kids.
I also urge people to just remember that although, in most parts of the country, we are in a much better place when it comes to COVID-19, that it is still circulating pretty widely throughout the United States. And so there is still the potential for exposure and infection within our unvaccinated populations. So we do still need to take it very seriously.
And most of all, she says, be the example for your kids.
And part of the way that parents can motivate their children and to take these behaviors seriously is to model those behaviors themselves. That goes for all parts of childhood development, not just the COVID-19 pandemic. Setting those examples, not just giving your child instructions and telling them what to do, but showing them what to do is probably even more effective than giving your child instructions.
And as more things open, Olivero says when it comes to potential exposure to COVID, it's important to remember to keep your quarantining guidelines, keep to the quarantining guidelines and get a test as quickly as possible. Meanwhile, clinical trials are currently underway to help kids under 12 get vaccinated. Today, Dr. Anthony Fauci, who's helping lead a lot of the country's COVID research, says kids of all ages should be able to get their shot if choose to by the end of this year.